So if we've reached the point in the visit where we've diagnosed hip arthritis, then we'll talk about some treatment options. Certainly on the very conservative end of things, physical therapy is at the forefront of treatment. Physical therapy is meant to work on strengthening around the joint, strengthening the core, strengthening the quadriceps muscles, the hamstring muscles, the glute muscles, all of which help to support the joint. Even with mild arthritis, a strong core and a strong foundation will help somebody live with arthritis much better than if they weren't doing those kinds of activities. Sometimes we add in a simple anti-inflammatory medication, an oral anti-inflammatory medication. These are referred to as NSAIDs, or non-steroidal anti-inflammatory drugs. Most people can tolerate these. This can be as simple as a once-a-day prescription anti-inflammatory medication that we use sparingly as needed, as arthritis does tend to flare with inflammation and thereby causes pain. So that's something that we need to understand in terms of why we use anti-inflammatories to treat arthritis. As I said, arthritis is an inflammatory condition, inflammation of the joint caused by the breakdown of the cartilage, a condition we call chondromalacia. If we're going to help somebody's pain, then we want to treat the inflammation. So that's why we use anti-inflammatory medications to help treat the pain. So there are other oral anti-inflammatories that can be used. Those are the steroids as opposed to the non-steroids. Those can't be taken every day, but those can certainly be used in sparing doses to really help somebody's inflammation flare. There are also topical creams that exist on the market. These are over-the-counter medication creams that are anti-inflammatory in nature. Those can be very helpful, used alongside of oral anti-inflammatories as well, again in a sparing basis. Some of the secondary effects of beginning to have arthritis of the joint, which again will cause inflammation, which leads to pain, and the pain will then lead to lack of range of motion. And even some of the arthritic process is certainly going to lead to stiffness within the joint. One of the best ways to mitigate the stiffness of the joint is to begin a good stretching program. We send people to physical therapy for stretching activities to stretch the iliotibial band. This is a lateral tendon of the thigh. This is something that progressively gets tight in almost everybody that develops stiffness of the hip. And if we can work on stretching the IT band, that can really help somebody live with their arthritis much more comfortably. Other conservative treatments would include hip steroid injections. Again, these are temporary injections that can provide anti-inflammatory fluid to the joint. This is typically done by an injection specialist. This is typically done under a local anesthetic, basically numbing medicine in and around the hip area. They're then delivered under X-ray guidance in order to provide an anti-inflammatory injection to the joint. This may not be permanent, but it certainly can help somebody live with the arthritis better, and along with an otherwise well-developed and comprehensive conservative treatment plan, can certainly help people live their lives more pain-free.